The information from this video comes from Shanker's Self-Reg, Dr. Stuart Shanker, and the Merit Center's work. We encourage you to look at the website www.selfreg.ca for more information on topics such as co-regulation and self-regulation.
Welcome to the School Therapy Occupational Therapy video series. In this second video on co-regulation, we will focus on different sources of stressors in our lives. It is important to recognize all the different kinds of stressors children have in their lives and that we have in our lives. You will recall from our first video that stressors require our body's energy to deal with them, making it more difficult to stay regulated. The more stressors we have, the more likely we are to be overstressed, resulting in a stress response, also known as the fight or flight response. This taxes our energy and can cause dysregulation. When we know the sources of stress, we can do our best to reduce those stressors, regain energy, and regulate ourselves and others. As stated in our first video, it is not as likely that we will have the stress of being chased by a wild animal anymore. So why are we and children so stressed? Let's take a moment to expand our understanding of what stressors exist in our lives. Dr. Stuart Shanker divides stressors into 5 domains: biological, emotional, social, cognitive, and prosocial. Some examples of biological stressors are allergies, hunger and thirst, fatigue, feeling sick, cigarette smoke or other strong smells, difficulty seeing or hearing, fluorescent lighting, uncomfortable chairs or you feel uncomfortable in something that you're wearing, the temperature of the room, such as feeling too hot or too cold. Some examples of emotional stressors are when a loved one is sick, separation or conflict, deadlines, comparing yourself to others, hearing someone speaking badly about a loved one, embarrassment, not feeling welcome, loneliness, public speaking, moving, and frequent or unexpected changes in routine. Examples of social stressors are parties, peer pressure, group work or team sports, being bullied, feeling left out, lack of friends, social media, having to introduce yourself to new people, keeping calm when talking to someone who is experiencing a stress response, crowds, or walking into a school or professional function and not seeing anyone you know. Examples of cognitive stressors are being the last to grasp a new concept or joke, having to do a task that is outside your skill level, learning a new language or learning a new concept, having a poor working memory, having learning challenges in reading, writing, or in math, slow processing speed, too many interruptions, time pressure, or being put on the spot. Examples of prosocial stressors are being late, difficulty reading others' cues, feeling the stress of your students, children, or loved ones, feeling unprepared, injustice, world events, expectations of others, lack of empathy due to compassion fatigue, putting others' needs before your own, and feeling guilty that you are not doing enough. These lists are not exhaustive and are very informative in expanding our understanding of what stressors exist in our lives and in the lives of children. Did you identify with any stressors that you have going on in your life? Please remember that these stressors use up your energy, so taking care of yourself and decreasing your stressors is critical so that you are better able to co-regulate others when needed. Expanding our understanding of sources of stress helps us with the identification of what stressors a child might be experiencing and ultimately triggering a fight or flight response. When we know what their stressors are, then we can actively try to decrease or avoid those stressors, which will result in the child having more energy to stay regulated throughout the day. If you would like more information on the most important co-regulation strategy, please watch the next video in our School Therapy Occupational Therapy video series.